Today, our special guest will be Charlie, and Charlie will share his perspective on getting into the mental health field. Okay, so good morning.
Hi.
How are you?
Doing great.
Wonderful. Thank you so much for your time, right? Time is so valuable to talk and just to connect and just to share. So how long have you been in the field?
Well, I was thinking about that coming to work this morning. So I think this is around my 47th year.
47 years. Oh my.
Yeah, the reality of that, I think, is, you know, I think about this when people come in, I'm going like, gosh, most of my population, I've been doing this longer than these people have been living. So, I mean, there's a lot of things that changed,
Yes.
you know, and whatnot. But I have to remind myself that too, you know, at the same time. But yeah, it's been, sometimes it seems the whole 47, and sometimes it seems it went pretty fast, you know.
Wow. So I could imagine a lot has transpired over the last 47 years, right? What have some changes have you seen throughout the decades?
Well, I guess the first thing that comes to my mind is that when I first started, you know, our Holy Grail or Bible that we were taught is the DSMs. Mm-hmm. You know, we kind of, you know, we use that. And when I first started, we were in DSM 2. You know, so sometimes I talk to therapists, young people, and I said, just for the heck of it, go back and find a copy of a DSM-2, you know, and get your DSM-5 and put them side by side and just flip through and see how things have changed. See how many things were taken out, you know, that just weren't. So, you know, that's kind of interesting when you use that for like maybe a benchmark,
yes.
You know, when things started. But, you know, gas was 29, 30 cents a gallon then too, you know. So,
compared to what it is today, right?
Right. I mean, lot of things. But anyway, yeah, it seems, sometimes it seems rather short. It went fast, you know.
Has the population changed for you over the last 47 years?
Yes. I think if you look at longitudinally, if you look at it, you know, I was treating before there was post-traumatic stress, because that only came out in DSM-3, you know. But anyway, you know, you think about it, I was seeing World War II veterans that are now not very many at all.
Yeah.
And if they are, they're, you know, they're centurions. So, you know, if you look at that and how, to me, I look at things that stayed pretty constant for a lot of years. And then all of a sudden technology comes in and, you know, things really start to change in you know, in the 90s. But for a lot of years, they didn't change that much, you know. Certainly, the way of the world created more problems, I think, challenges for people that would come in, you know. But I guess if I would have to look at that in another way, it's like in the years past, so I'd have to say 15, 20 years ago, people would come in with one issue.
Yes, yes.
You know, I'm in here because I have, I think, agoraphobia or social phobias, you know, or some form of depression. And kind of the way we were trained back then and the way things were going, you kind of focused in on that one thing to try to, you know, get the best diagnosis you could on it. But now, in our era now,
Yes.
you know as well as I do, we don't see that anymore. You know, there are layers, layers. But in a way, I find that more interesting in my work, because you feel like you're seeing and helping the whole person.
Okay.
You know, so I think that's why it's so critical today when you see people to do a good functional analysis on it. You know, a person might say, well, you know, I have a fear of flying. Well, okay, well, I have to sit near the aisle and this, that, and the other. Well, tell me about other. Well, you know, I didn't like to touch things because, you know, it's okay, so now we got a little OCD stuff going on here. So it just turns into a spectrum thing, you know. So I think it helps people to realize that, because they don't realize it that way.
Yes.
You know, it's like, oh, well, that really does affect me, but that's not my focus. My focus is over here. So I think that's, you know, I really like working with people now and doing that, you know.
Wonderful, wonderful. So May is Mental Health Awareness Month, and this year the theme is More Good Days Together. More good days together. What does that mean to you?
Well, I think it would be very difficult to define that without considering where we are as a nation now. You know, things are so dynamic, they change so quickly, but you know, if you look back a year and a half ago and say, okay, where were we as a country, a society, how were we, you know, how were we getting along? Were we more content, and were we happy? You know, and here's the thing. What about our worry level? You know, so I think even since you asked me to be part of this, which I'm grateful and whatnot, but things have happened. I mean, major things have happened.
Yes.
You know, I've just been in a field of anxiety for so many years that this is a different kind, different fears, you know, and you just can't look at somebody and say, you know, things are going to get better tomorrow. Well, to me, those things are very difficult to control. You and I, we can't control those.
Sure.
But it's like I tell people who have intrusive thoughts about anxiety and OCD and this, that, and the other. I'm going like, well, let's start simple and say, you can't control about 60,000 thoughts a day that we get.
Yes, exactly.
The key to it is, how do you respond to them? How do you treat them? What kind of relationship do you have with your thoughts, even if they're intrusive? Or what about the lady who has 2 children who are in school, and God forbid there's a catastrophic event at a school, and you just can't look and say, well, you know, that won't happen in Rockford. We don't know that.
Exactly.
You know, so part of it, I think, is kind of you have to make the best out of what we have, you know, and the way you do it is finding some kind of support with other people, you know. And of course, COVID just, you know, changed everything for us. No one had ever gone through that before. And it wasn't only our country.
Exactly, the
You
world.
know. So, and it changed you and I.
Definitely.
I mean, we didn't know anything about virtual therapy. How am I going to help someone with contamination OCD?
Yeah.
You know, when I'm so used to hands-on anyway. But yeah, I think it's we're just going to have to find a way to be more flexible and accepting of things like this are going to happen. You know, I think this is the world we live in now.
Exactly.
You know, not our state, not our town, but we're affected by everything, you know.
Yes, definitely.
So, comforting people, I know I've gotten out of the habit of saying, well, you know, it's going to be all right, you know. And then the next time they go like,
you said it was going to be all right. What happened?
Yeah, where were the guarantees? I'm going like, well, you know, I didn't think about, you know, going to war or whatever, you know. But anyway, I just hope that more people take it serious when we say, or you know, our national organization stuff say it's Mental Health Month. You know, not a week.
Yes.
That's the thing, the whole month.
Yeah.
So I think there's a lot of awareness, and it's more critical now than ever. I mean, I don't know when it's been more critical, you know.
Definitely. What drew you into the field?
Well, I guess my path was a little bit different. I had been in the military quite a while, and both of my children were born while I was in the military. So by the time I decided to leave the military and continue my education, you know, my family was established and whatnot. And so anyway, I went, you know, chose my school and went through all the logistics of that. And I was on the GI Bill, which helped a lot, you know. And so I started out with the idea of going into business. You know, everybody back then, I think it was like, if you don't know what to do, go into business administration. You know, so anyway, I started out like that. And when I took my first accounting class, we had this professor who was also a large farmer. So he was a professor there. He was just a great guy. He was from China, and I just could not get the accounting thing down too much, you know. But and this professor, he was kind of like, okay, he says, there are going to be 2 of you that make A's, and then the rest of you are going to make C's, and there are 2 or 3 of you that are going to drop out, and blah, blah, blah. You know, and I'm going like, wait a minute. I mean, I don't like that. You know? So anyway, it probably discouraged me a little bit. But what happened is the first psychology course I took
Yes.
was a little bit different. I mean, we walk into this room and there are about 30 of us, and the professor is sitting up at the table, and it was in the South, so, you know, it was hot, and he's sitting there with sandals on, and, you know, he looked like Captain Kangaroo for people that have lived long enough to know that. But he was a great guy, and he was the department chair. And everybody took a seat, and there was a book, you know, a textbook where everybody sat. And I can still remember the face on the book. And it was I'm going to draw a blank here, but it was a painting that was done, a famous painting that was done in France, where these people were by a river and everything. I can't remember who did it. But anyway, he just said, you have a book, and he says, this is called At Your Pace Psychology course.
Different.
He says, well, here's the thing. He said, you read a chapter and you come to class and you take a test. If you pass it, you go to the next chapter.
Okay.
So if you want to read 5 chapters and pass them, you can finish the thing within, you know, 5-6 weeks. I'm going, I like this. You know, but this psychology book, you know, it had every category of psychology in it, so it was about that thick.
Yeah.
And it wasn't as easy as you thought, even though you read your book and you took the test, you know, but it was how he constructed the test. He made you really cover it and think. Yeah. But anyway, I got through it a couple of weeks early, you know, and so I just had developed, being older too, I developed a relationship with him. And his wife was also a professor. And so he invited me to take a class under her, which was developmental psychology. So that just started it. And after that semester, I'm going like, no, I'm not. No, this is where I need to be instead of business. Yeah. So that kind of started it, you know, and I just liked everything. And every class got a little bit more interesting and interesting. And I'll tell you something that it is interesting. I just thought about it. One of the courses that Dr. Maneri taught was motivational psychology. So we show up to class, and he says, "Okay, everybody get up." Which now you have your serious majors. You know, you got about 20 of us. So we get up, and he marches us up to the animal lab, and he goes by and he says, "Okay, I want everybody to pick out a Norway rat, and put your name on the cage." And we're going, okay, what's this all about? So anyway, we go back and we sit down. He says, you have elected to take motivational psychology. He said, this is what it's going to be. The animal that you just picked, you're going to train them for our rat Olympics. Which they had done. They only did it about every 3 years. I had heard of it, but I'd never seen it. So they had these things like the broad jump and the 100-centimeter dash, and
the rats are doing this.
Yeah. So it's like you figure out how to motivate them. You know, with very little help. But you had to read your book, you know, and whatever. So it came time for the big
Olympics,
the competition, Olympics Day, you know, and it was unbelievable. It was in the Coliseum where they played basketball. They had writers, you had Runner magazine, you had people out of Memphis, you had all of these people. I'm going like, holy cow! But anyway, I had worked really good, and I said, I'm going to get a female rat. Females are smarter, you know. So anyway, they had all these things going on, and we won.
Whoop.
You know, and I won.
How did you go about training the rat to do the task that you needed the rat to do? Did you name your rat?
Right. Well, but I did, and this is, I named my rat Debbie. You know, she just looked like a Debbie. You know, and my kids loved it because I'd bring her home every once in a while, practicing and stuff. You know, whatever. But it was just by figuring out what kind of reinforcement, because back then it was behavioral, a lot of Skinner, Watson, a lot of that stuff. And so I just, you know, I kind of, it was all trial and error.
Okay.
But I learned that this personality and this animal probably wouldn't work with other things, you know, so. And it lasted for the whole semester, so it was I worked a lot, spent a lot of hours doing it, you know. So I figured out what kind of food was the most reinforcing, what kind of negative reinforcements. So just to name two, if I remember correctly, one was, for some reason I figured out that Debbie loved vanilla wafers.
Oh.
Do anything for a vanilla wafer. Jump, I don't know, it was long, you know. And then the other thing was, and for all these people that are watching, no, I'm an animal lover, so it wasn't animal cruelty here. But I did classical conditioning with a hairdryer.
Oh.
So exposing to the blowing hot air, eventually, and then condition them to only the sound of the hairdryer.
Oh, wow.
You know, so sound, heat, run, you know, it's whatever. But, and I forgot what I did, but it was, it was a really good class. So I was thinking about that. I'm going like, I never heard of the Rat Olympics since then. I don't know if that was just, you know.
Yeah, I wonder if would they even do that now in the curriculum, right?
Right.
Yeah.
Well, I don't know.
Yeah, wow. How do you go about taking care of yourself with the population that you serve, with all the information that you're getting and hearing? How do you de-stress? How do you recharge? What does that look like? What does that feel like?
Well, I guess a lot of that's been taken care of because now I'm very limited in what I do. So I work, you know, you see me in my office. So Wednesday I work a long day. And
What's
then
a
like
long day?
a long day for me is starting at 9 and going to like 7:30.
Okay.
You know, and it's pretty much back to back. I try to control the batting lineup so I know, you know, I don't want to get all the good hitters back to back or bad ones, either one. Or, you know, if you got, you know, younger people you're working with, you kind of want to just figure out that, you know, to me that's part of taking care of myself, you know, not piling up stuff. Or diagnoses that look the same, you know, so you don't, it gives you kind of a mental break, you know, and then on Saturdays now, in the wintertime, I come in and see about 3 people. So it's not as much of a challenge to deal with stress right now. Actually, I don't even call it work anymore. You know, I call it, I'm going to see my people, or I'm going to, you know, I'm going into the office or whatever, but work's not in my category too much, unless it's on my little farm.
Oh.
Like I was telling you earlier, I was working a lot yesterday, but.
So you have a farm?
Yeah, I have horses. My wife and I, we have horses and animals, and we live, you know, out on our little farm, and and whatnot. And my wife's a retired principal. She was in education over 40 years, you know, herself. So yeah, we find that, you know, kind of our own little retreat. So it's, to be honest, it would be much more difficult for people that are starting or maybe in the middle of their careers, where their caseloads are much higher, you know, and whatever. So just by the nature of where I am in my career right now, it kind of take care of itself. You know, it's not. You know, I don't feel. Actually, I feel better when I go home now. After visiting with people, you know.
Why is that?
You know, I think for some reason I get more positive feedback when that person walks out of the office now. And that's one reason, is because I've kind of changed some things. I used to do it the opposite. So now I usually take the last 5 minutes or so in kind of reviewing what the session went like, and what didn't go like it did, and what if we needed to change stuff, and this, that, and the other. And I always, now I'm going like, okay, what can we talk about where it's going to make you feel better when you leave today? You know,
So you shift.
Yes, yeah, you shift gears a little bit, exactly. You know, so it leaves them on a positive, I think, a positive note. You know, and there's one thing I say, just kind of kiddingly, I guess, as if that's a word, that I'm looking at them, I'm going like, you do think you'll come back next week, don't you? Oh yeah, I'll come back, you know, and stuff. So, but I think if you get to the position I have after working these years, you know, things just change like that. Plus, they know the same thing about you too, you know. So, it's just, to answer your question, I think it's just, for me, it's easier to not feel stressed out. You know, I'm not burnt out. You know, I've had it before, but just a real quick note. When we had to endure COVID, I was very fortunate. I never got sick. I never got it until a lady that I'd been seeing and love her to death, she came back with her family. They had been to Puerto Rico on spring break. And so she came back, and we were scheduled to see each other a couple of days after she got back. Well, actually, I think it was the next day. Well, she's walking down the hall and sees one of the other gals leaving my office, and they sit and talk and everything. And I'm going, well, when you guys finish, you know, you can come on down. You know, so anyway, she said, you know, Charlie, maybe I need to wear a mask, because we just got off the airplane. We were in Puerto Rico, you know, and everybody had been vaccinated that wanted to be. And I said, well, I'll wear mine too, you know, and we sat, you know, way apart from each other. Well, the next morning, about 11 o'clock, I got a call from her, and she said, you know, I really hate to tell you this. She says, but we all tested.
Oh my.
Positive. So anyway, I'm panicking and whatnot. And I said, well, maybe I won't get it, you know. Well, 2 days later, sure enough, I came down with it. And I had a real, I struggled with it. And it ended up being long COVID. So I was not coming out of it like normal, you know. And I was in the bed a long time. So I was thinking, maybe this is the time for me to hang it up. You know, I've been doing this a long time. Maybe this is maybe this is what I need to do.
Yeah, yeah.
So actually I did. I informed everybody, went through closure, the whole thing. So I think it was around April. So I didn't work, come to my office, and it was the first time in my life I'd never worked since I was 15 years old.
Oh my, how old are you now?
Well, I'm 76.
Woo.
Almost.
Almost.
But anyway, so I did, you know, and I closed my office, and that September, I woke up one morning and I felt my old self again. All the fog had gone, you know, and all of I felt like, wait a minute, you know, and so I decided, one of the gals here that I worked with, Mata, when she was a young, just getting into it, and I was a supervisor, you know, I asked her, I said, could I use your office once a week? I'd just like to, you know, whatever. So I opened it up on Wednesdays, and I called some people, you know, and of course they were raring to go.
Yeah.
Oh yeah, you know, pick me right up. So then, you know, I used her office, and I said, well, you know, I kind of like my own space, so. So now I just feel like I'm kind of back where I was before that all happened, except just limited days.
Gotcha.
You know?
Okay.
But I thought it was one of the best. I thought it was one of the best decisions I've made, because what I've realized is people that retire, their mental health suffers.
Oh, that's
Unless you have something really, really, really good that you plug it in with. But for me, I need to. This keeps my brain healthy. It keeps my mental health.
Yes.
You know, where it needs to be.
Definitely.
You know, and I look forward to it.
Oh, for
you
sure,
know?
for sure. And on that same note, right, when I say cherish your mental health, what does that mean to you? Cherish your mental health.
Well, of course, I'm going to be biased. What I think is that there's an old saying, we've heard it all of our life, you know, if you don't have your health, you don't have anything. I've always added something to that. I said, if you don't have your mental health,
Yes.
your body is going to suffer from it.
Oh, that's good.
Don't you think?
Good.
I mean,
that's good.
I think
You
other
need to
people
put that
looking
on a
at
T-shirt.
yeah, maybe. I mean, you're good at that. I mean, you come up with these things. But yeah, I said you're right, but you need to add something.
Yeah.
Your mental health. If you're not thinking right, you're not going to feel right.
Exactly.
You know, if you get up in the morning and say, well, you know, here it is in March and we've had 10 inches of snow. You know, it's like you're setting yourself up. You're going to be a downer, you know, so no, it's just, but I think awareness is the key too.
Yeah.
Get up every morning.
Yeah.
Find something you are grateful for. Give thanks that you are walking, talking, you're not in a hospital, you know, and take care of your mental health. Like, first of all, just being aware of it, you know. And I think this is where maybe we come in somewhere along the thing, where they get to the point and say, you know, those self-help books, they ain't hitting it, you know. My friends, you know, maybe I just need to go see somebody.
Yes.
And it's scary, you know. It's scary for some people to do it. But I think we're seeing more people do it, you know, whether it's the world we live in or whatever. My wife was talking about this because my phone rings all the time, I turn people down. She said, you know, if you wanted to go back full time, how long would it take? I said, probably like 3 weeks or so, you know,
Yeah.
but I couldn't deal with it. You know, that's too much. But anyway, yeah, we've always heard, you know, if you don't have your health, you don't have anything. And I just, if you don't have your mental health,
Yes, mental health.
the rest of something's gonna be causing you some problems. You know?
Definitely, definitely. So for those that that's coming into the field, right? What advice would you give those individuals?
Well, probably my first question would be very short. Are you sure? Are you sure? But I mean, we weren't either.
Yes, exactly.
It's kind of trial and error, right?
Yeah.
It's just, I haven't been I was in the academic setting when I first started, but I'm not really sure how the curriculum's set up now in teaching. I just think hopefully it's more culturally based. What I tell people that ask me that is that I think you need to be more aware and educate as much as you can about neurochemistry, about how does the brain work. Now I'm not talking about from a neurologist standpoint of view, but and I'll tell you why. What I have found out is that, you know, most of our clients are high functioning people. So that's when I said, no, you have high functioning anxiety. You go to work.
Yes, yes.
You're finishing school.
Yes.
You manage your life, but you got high functioning anxiety. So with that being said, I think what's helpful for me is we have to assume that people are smart, you know. So I like to teach them what is going on in your body and in your brain when you're having moments, episodes, blah, 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 you know. You'd be surprised at like, oh, if I'd only known that, you know, if I'd only known that that's what's going on. Real quick, a really quick example of that.
Yeah.
Somebody is deathly frightened of a panic attack and this, that, you know, which now we know is all autonomic nervous system arousal and things. And I use this every once in a while, and I call it the aha moment, right? So they're sitting and they're telling about, oh, I'm paralyzed, I can't do this, that, and the other. And I said, well, but you go to the gym a couple of times a week, right? Yeah, well, tell me what you do. Well, I do, you know, ellipticals, I do the stair stepper, you know, aerobic stuff, and then I lift weights and everything. And I'm going like, well, what is one of your goals? Well, you know, I have to get my heart rate up because that's where I lose my, you know, burn my calories and I lose my weight. I said, well, how do you feel when you're like that? Now, I'm not talking about the Red Bull. I'm talking about how do you feel? And they go like, gosh, I really feel good. And I'm going like, well, don't you think that you have the same body, organs, everything you do at the gym versus when you're sitting at home? Your heart rate getting up at the gym doesn't scare you, but when you're sitting there watching, you know, TV and out of the blue, you're going like, oh my gosh, this shouldn't be happening. Maybe I need to go to the hospital, this, that, and the other. And they go like, well, you know, you're right. I only have one sit. Yeah. Your adrenal glands are on top of your kidneys, right? Yeah, well, what do? They make adrenaline, right? Okay. What do you use in the gym? So it's your thoughts and how you're treating them. You get scared at home when you're taking care of your baby, but when you're in the gym, you're fine.
Yeah.
And they go like, well, I need to consider that. Yeah, yeah. You know, so it's just little things like that that you wouldn't think would work. But that's you know, part of why you got to, if you educate people, we call it psychoeducational, right?
Yes, yes.
So I do a lot more of that now.
Okay.
You know, so you assume that they'll get it.
Yeah,
you know?
definitely, definitely. Any last minute thoughts that you would like to share that I didn't bring up that you would like to bring forward?
Well, I appreciate you asking me to be part of this, which, you know, I'm glad somebody has the energy and motivation to do it, because somebody has to be, you know, an advocate and whatnot. No, I just hope that, you know, we can continue to make advances. You know, if you're in it as long as I've been, it's like, what are we going to do different that works better? It's dynamic. You have to, this is what I was going to tell you, I think, a while ago. It's like, if you're not willing to be flexible and adapt, because you have to. Yeah. How many people do you know in our profession that weren't able to do that? They were still set in the same way that they were trained.
Yes, yes.
So nowadays it's like, well, there are a lot of things about gender and stuff. We never had that in school. I never was taught that. In fact, go back to DSM-2 and read that. It's not very favorable. So it's just, be willing and open to when that client comes in and tells you something you've never heard before, and you're going like, oh my gosh, what am I going to do now? Let them tell you. Better than books.
Yes.
Better than books,
yes,
you know.
Yes, yes, yes.
So anyway, I don't know how much longer I'm going to do it. I think until I can't. Okay. You know. So I don't know if it's up here or the rest of it or whatever. But I know if this is part of my weekly routine and whatever, I think it will add to longevity.
Without a doubt, without a doubt.
I hope so.
It will. No hope, it will. It will. Thank you so much, Charlie, for your time, your commitment. Much appreciated.
You too, hon.
Yes.
Appreciate it.
Yes, yes, yes.